Medicine likes to tell itself a story that if you work hard enough, study long enough, sacrifice enough, you'll eventually earn your place. That medicine is a meritocracy. But what happens when the data begins to suggest that some physicians are being pushed out of training at disproportionately higher rates than others? Today, we're talking about something uncomfortable, not because it's political, not because it's trendy, but because it affects real physicians, real careers, and ultimately real patients. My name is Dr. Aisha Rush, and welcome to episode 4 of Informed and Unfiltered, where we discuss the real truth about medicine. So today we're going to be discussing a topic that is not often discussed and quite frankly swept under the rug. This can be a delicate topic for some, but delicate or not, it's the truth. So let's dive into it. Recent studies and investigative reports have shown that African American resident physicians are dismissed, pressured out, or fail to complete residency training at significantly higher rates than many of their peers. Stat News wrote an article titled, "Black Doctors Forced Out of Training Programs at Higher Rates Than White Residents." JAMA Surgery featured an article titled, "Racial and Sex Disparities in Resident Attrition Among Surgical Subspecialties." A PMC study on orthopedic surgery attrition disparities found that Black residents had attrition rates approaching 10%. That was substantially higher than white residents. JAMA Network Open featured an article titled, "Racial and Ethnic Differences in Internal Medicine Resident Assessments." I could go on and on about the number of articles and the amount of research out there that discuss this very issue. And before some people immediately become defensive, let me say this clearly. Residency is hard for everybody. Every resident struggles. Every specialty has pressures. Programs absolutely have a responsibility to maintain competency and patient safety. This conversation is not about lowering standards. It's about asking whether the system itself applies those standards equally, consistently, and fairly. Because when patterns continue to emerge across specialties, institutions, and years of data, we have to be willing to ask difficult questions. What exactly is happening inside residency culture? Why do some trainees thrive while others quietly disappear? And why are so many physicians afraid to even talk about this publicly? One of the biggest misconceptions about medicine is that once you get into medical school, the hardest part is over. That's a joke. Because in reality, residency can become one of the most psychologically vulnerable periods of a physician's life. You're exhausted. You're sleep deprived. You're constantly evaluated. Your future depends on subjective opinions from people who hold enormous power over your career. And let's be clear here. Residency is quite a bit different from when I went through the process. During my time, we were used to working over 100 hours a week. There were times when we were up for 36 hours or more, dividing time between patient care and learning didactics. Today, residents work an 80-hour work week. They have protected time that is truly protected, where patient care is off the table during these times. Residents today have more protections than when I was going through the process, but somehow for some of these protections mean nothing and frankly does not apply to all. And unlike medical school, residency often offers very little room for error. A single label can follow you forever. Some of these labels can be things such as not a good fit, lazy, difficult, too emotional, aggressive, confrontational, intimidating, defensive, unprofessional, incompetent. Some of these labels may be justified, but the problem is that medicine has historically struggled with subjectivity in evaluations. And multiple studies now suggest that minority trainees, particularly Black residents, often receive harsher evaluations, less mentorship, fewer second chances, and lower levels of institutional support. I know this to be true. I personally know of 2 Black female residents who were removed from their residency program, were given very little room for remediation. They were definitely not as inadequate as they were made out to be by evaluations, and they definitely were more prepared and had more medical knowledge than some of their counterparts. Some of this is not always overt racism. Sometimes it's isolation. Sometimes it's unconscious bias. Sometimes it's cultural misunderstanding. Sometimes it's simply being the only person in the room who looks like you. And medicine can be incredibly lonely when you already feel like you have to prove you belong there. What makes this even more complicated is that many residents don't speak publicly about their experiences. They're too afraid to speak about these painful experiences. God knows I was and still am today. This fear comes from fear of retribution, fear of the idea that if you speak about it, people will see you differently or think you're trying to pull the race card to cover up some kind of inadequacy. The fear that you'll be damaged goods and your career as a physician is over because the likelihood of getting another residency spot is null and void, because who wants someone that's willing to blow this kind of a whistle? So many times when these things happen, people feel alone. And quite simply, in many cases, you are. You have no one to turn to, no one to understand how you feel, and you don't know who will be an ally or who will be an enemy. What makes this even more complicated is that medicine is small. There can be retaliation. There can be licensing consequences. There can be credentialing issues and future employment concerns. The negative possibilities are vast. Many leave quietly, and the public never hears their stories. But there's another side to this conversation too. Residency directors are under enormous pressure themselves. Programs must protect patient safety. Programs must graduate competent physicians. Not every struggling resident is being treated unfairly. And it's important to acknowledge that. Because if we oversimplify this conversation into good guys versus bad guys, we miss the deeper issue. The real issue may be that residency culture itself has become unsustainably toxic for many physicians across races, genders, and backgrounds, while disproportionately impacting certain groups even more, including women. And honestly, that should concern everyone. Because when physicians train in environments driven by fear, humiliation, silence, and survival, it changes people, sometimes permanently. Some physicians become stronger. Others burn out. Others leave medicine entirely. And some carry those experiences for decades. Those that carry it for decades show that damage they've sustained in how they work, how they treat their colleagues, how they treat staff, how they treat patients, and the decisions they make at work and in their overall life, in their personal life. I know some of these people. I will never forget receiving a message from a fellow medical school colleague, about a resident who was having an extremely hard time in her residency. She wanted me to reach out to this resident to discuss ways of having that resident safely exit her program. I too was a resident at the time. After speaking with this resident, it was extremely painful to hear some of the things she was going through. But the crazy thing is, I could relate because I too experienced some of these very same issues. It was uncanny to just listen to somebody reliving parts of my life or retelling parts of my life. Luckily for me, I had amazing allies who were there to help me. They understood what was happening because it was so blatant. It was so apparent, even a blind person could see what was happening. See, for me, I've always been an advocate. In residency, I was very vocal about service over education. And as I mentioned, I've always been an advocate for education and an advocate for fairness. And not just fairness for me, but for everyone. In our program, I felt like we weren't learning anything, and I was concerned about being able to pass boards. Our so-called protected time back then was not really protected for all residents. It definitely wasn't for me. Some residents were given the ability to take the time to study and read, while I was ordered to be out on the floor taking care of God knows how many triage patients and multiple laboring patients all at once. And God forbid if you ask for help. If you did ask for help, you were considered weak, lazy, inadequate, and incompetent. So after hearing more about this resident's story, it seems she could do nothing right no matter how hard she tried. She showed up earlier than any of her other counterparts. She did more work than many of her other counterparts. She studied much harder. These efforts were never acknowledged, and the program always seemed to find something wrong with what she did, even when she was not even on service and could not have even been present for certain events. They found her responsible for that. It sounds insane, but it really did happen, and it was crazy. It was quite clear that she was being targeted, and she was not inadequate and definitely did not lack medical knowledge. Medicine was her second career, and she graduated from one of the top schools in the country in her original field. After I spoke with her and told her the steps necessary to move on, she heeded my suggestions, did the work, and was able to move on and complete residency. Thank God. I am so grateful to say that this particular person and I found each other again after about a decade in an interesting chain of events and are friends to this very day. I am so grateful to her as a person, as a friend, but more than anything, I'm grateful for the not so great experience that I had that eventually gave me the ability to help her. I'm glad I didn't remain silent. This conversation also matters because diversity in medicine is not just a social talking point. Patients often do better when they feel seen, heard, and understood. Communities benefit when the physician workforce reflects the people being served. And when talented physicians disappear from training programs under questionable or inconsistent circumstances, medicine loses something valuable. But I also don't want this episode to end in hopelessness, because it's not hopeless. There are ways we can try to fix this. Because really, there are programs that are doing this well. Programs with strong mentorship, programs creating psychological safety, programs identifying struggling residents early and helping them succeed rather than simply documenting failure. That matters. Support matters. Culture matters. Leadership matters. And transparency more than anything matters. Transparency is one of my biggest things. Medicine cannot continue to pride itself on scientific rigor while ignoring patterns that deserve honest examination. And maybe the goal here isn't to accuse. Maybe the goal is simply to ask, how do we build training environments where excellent physicians can succeed without being psychologically destroyed in the process? Because at the end of the day, residency should challenge physicians, but it should not break them. But we also have to be cognizant of the no child left behind idea, where we continue to foster mediocrity in residency programs where we shelter a chosen few and pass them along because they were good at flying under the radar. I know a few of these people too, and unfortunately, they haven't changed much. This shows in their work ethic, how they conduct themselves, how they treat others around them, and ultimately, how they treat patients. My story regarding my residency training is a tumultuous one, but also an amazing one. I met so many people who looked out for me, who nurtured me, took me under their wing and let me know that I was valued, I was smart, I was resilient, and reinforced the fact that I was going to be a good doctor. To all of those people, you know who you are. And I want to sincerely say thank you and give you my sincerest gratitude. You changed my life, and I will be forever grateful for how you respected me, you treated me, loved me, and still care for me and reach out to me to this day, and are still my rocks to this day. But I also had to be present during that time. I had to speak up. I had to seek those people who I thought would be great mentors. I had to show interest, and I did, because I was truly invested in knowing everything I needed to know about my craft. When people see that, they want to be there to teach you even more. Some of my mentors are still my mentors to this very day, and I thank God for them. Today, I pride myself on being an educator. I can be tough, but I'm fair. As an educator, I always let my residents know that I have an open door policy when it comes to concerns. And I always tell them, no question is a stupid question if you don't know the answer. I explain to residents that much of learning in residency is not just medical knowledge, but it's also being able to multitask and manage. I lend a hand when I see struggling residents. I take the time to teach and go over concepts. I try to treat and respect residents as the adults they are, because they are adults and not children. Some people forget this. I personally don't forget where I came from and understand what it was like being a resident. I never wanted to treat anyone the way my friend and I were treated. But medicine is not for the faint of heart. And I always tell residents, it takes no knowledge to kill a patient, but it takes all the knowledge to save one. I also explain to residents that when you know your stuff and you make sure you read and your medical knowledge is top-notch, no one can ever refute that. I believe this builds strength, trust, and resiliency. It builds character and hopefully the type of doctor that I and we would one day want taking care of us and our families. I'm Dr. Aisha Rush, and this is Informed and Unfiltered, where we uncover the truth about medicine, the good, the bad, and the ugly. Thank you for listening. If you found this helpful, make sure you like, subscribe, and share. Please be sure to stay tuned for more interesting topics. You can also find us on Apple Podcasts, Spotify, Buzzsprout, iHeartRadio, and Amazon Music. You can also find specific obstetric and gynecology topics on my personal YouTube channel under Dr. Aisha Rush. See you next time, where we'll be discussing yet another compelling topic. Take care.